right, we have Arnab Goswami is with us, our editor-in-chief. Well, this disease does not discriminate between anyone, Arnab goes, and this is Boris Johnson now positive for coronavirus.
Absolutely does not discriminate. I think this bit of breaking news really, puts a whole cloud over the tardy efforts of the United Kingdom in handling the coronavirus crisis. Remember that the initial response of the British government was very, very slow, that even till yesterday they continued to insist, that people should be able to go out for some exercise every day. The United Kingdom is a classic example of one country that has completely and pathetically failed to implement strong self-isolation, and that proves to be a real weak point at a time like this. And you remember that there was this whole concept of herd immunity, which had been pushed by the scientific advisor to Boris Johnson. And the whole idea was that if 60 to 70% of the United Kingdom, test positive for corona, they get some kind of herd immunity as a country. It's really bizarre that they've allowed things to fall to this pass. What happens when Boris Johnson himself tests positive is that, of course, question marks begin to be raised about why he allowed the country to go down this path. And the important thing also is that the United Kingdom has failed to implement anything close to a lockdown. Remember that the numbers in the UK started shooting up in the first week of March, and by about the 7th or 8th of March, the numbers in the United Kingdom were already around 500, and there were about 100 cases that were positive at that point of time, 100 cases that were positive in London alone, and yet they did not act. Now we have with us today Neeraj Kohli. Okay, Dr. Neeraj Kohli is joining us from UK. Neeraj, hi. Arnab here. Where in the UK are you live from at this minute, and how do you react to this news? Neeraj Kohli is a hematology specialist from the Worthing Hospital in West Sussex in the UK. Dr. Kohli, this news of Boris Johnson testing positive, how is UK going to take it? How is the medical community going to take it? How is the NHS going to take it? What does it really reflect?
Thanks very much. So it's absolutely. So I'm a haematology doctor in the UK. That means that I look after people with blood disorders, including blood cancers in the UK, and I work in Worthing, which is a town on the south coast. I think this news it's sad as with anybody getting coronavirus, but it's not surprising. We know how infectious this is, and we know how it does discriminate between how high up you are in the political rank, so to speak. Really, I think, you have commented on how there has been a delay in the sort of the public health response in the UK to sort of the lockdown measures and so on. And there has been a lot of debate about that in the country, a lot of discourse around it. Probably the important thing actually is where we are now in the country and what we do to actually mitigate any further impact from the coronavirus. That's probably the important thing at the moment, though.
But I understand that, Neeraj, but clearly, I mean, why has the United Kingdom not been able to implement a complete and total lockdown? Did it consider itself to be luckier than the rest of Western Europe or Italy, for example? Or was there a sense of political delusion, thinking that the big wave could not hit the UK? They just seem to be taking so much time, despite having enough time to plan and respond more effectively.
So I don't think either of those is the case at all, actually. As a health worker, so, on the front line looking after patients, I have had a lot of anxiety myself about whether we should have been locking down as a country much sooner. And that's an approach that has been taken in other countries, Germany, for example, including it sort of very, very early on community testing. There are a range of different approaches. I can't comment specifically on why the UK acted when it did at that point.
Of course. Well, we are all wiser in hindsight, aren't we? And therefore, perhaps it's not fair. We do hope Boris Johnson has speedy recovery, but this is going to give ample opportunity to all his critics to say that he himself is an example of political dereliction. The UK numbers as of now confirmed 11,816 cases, 580 deaths, recovered 180, and 2.2 thousand had tested positive on the 26th of March, on the day of the biggest spike. As India enters day 3 of this nationwide lockdown, comes in this bit of breaking news that Boris Johnson has tested positive. And he has tested positive just a day after the United Kingdom saw a 100 case a day rise in the spike of the number of COVID-19 patients. Was there a sort of a failure to arrest the spread in the UK? Absolutely. Also brings into intense focus, I would say, as I hand over to Niranjan, puts into intense focus the strong measures here in India, because the situation in India, number of cases, when we decided to implement a lockdown, was the number in the United Kingdom almost 3 weeks back. And they had the opportunity, and they did not implement the lockdown. And they have no business now to be telling us about whether the Indian approach works. Whether or not the Indian approach works, it's a whole lot better than the ridiculous, tardy and selfish response of North America and Western Europe. And of course, there was a sense of complacency. We saw it, and I can tell you, viewers, 2 days back, Prince Charles tested positive, and now Boris Johnson tests positive. It tells you about the degree of the spread, that if 2 of the people there who are most protected, most, I would say, quarantined as much as possible, would be Prince Charles and Boris Johnson. If they are getting it, then you can realize how serious the situation has been. My dear viewers,